Welcome back to Anatomy and Physiology on Catalyst University. My name is Kevin Tokoph. Please make sure to like this video and subscribe to my channel for future videos and notifications. In the previous video, we discussed some very basic information regarding the axilla. We talked about its boundaries, we talked about its basic contents. The way we're going to start this video is we're going to look at some of the bones here and the musculature that really make up the axilla. And we're going to build the quadrangular space, the triangular space, and the triangular interval. And the reason we're going to do that is because some components of the brachial plexus and the axillary artery are going to branch and go through those spaces. So it might seem a little bit irrelevant to the axilla, but it does have to do with it. So the first thing we're going to do is look at this picture right here and orient ourselves with it. This is an anterior view of the shoulder joint. Okay? This is an anterior view of the scapula. We know that for two reasons. One, there's no spine of the scapula. The spine of the scapula, if we can see it, is a dead giveaway that it would be a posterior view. Since we have this very large basin right here and no spine, this is the subscapular fossa, and so it's anterior. The other way we know is if we're looking at these two structures jutting off of the head of the scapula, this one in the back is the acromion. This one in the front, or anterior, is the coracoid process. We can tell the difference between them because the clavicle right here does not articulate with the coracoid process. It articulates with the acromion. And the coracoid process is always anterior. Okay? So that tells us, again, this is the anterior view. So here's the humerus right here. Here's the head of the humerus articulating with the glenoid fossa, or glenoid cavity of the scapula. And then over here we have the greater tubercle, and then this is the lesser tubercle of the humerus. And we know that the two tubercles form a groove called the intertubercular groove or intertubercular sulcus. We'll cover this in a lot more detail when we cover the shoulder joint. But remember that the long head of the biceps tendon actually runs through this groove. Okay? Now, on either side of the groove, we have a lip. Okay? So if we have a groove here, then where it kind of comes up, there's going to be a lip on either side of it. This side over here is going to be the lateral lip on the lateral side of the groove, and over here we'd have the medial lip. On the lateral lip, you can see here that we have the insertion of pectoralis major. And then on the medial lip, there's actually two muscles that insert here. We have the latissimus dorsi and then the teres major. Now notice these two insertions. The latissimus dorsi actually has the slightly more anterior insertion. It's also a little bit higher up. The teres major's insertion actually goes a little bit behind or posterior to that of latissimus dorsi. So latissimus dorsi is more anterior slightly. Teres major's is a little bit more posterior. And this may help you a little bit. One of the ways to remember this is that the lady lies between two majors. This is sort of an acronym type of thing that people have used. The lady, L, is long head of biceps brachii. That's its tendon right here that's in the groove, and it lies between two majors, pectoralis major and teres major. And technically there's also latissimus dorsi here. One other way you can learn this is the lady lies between a major and a lieutenant. Why a lieutenant? Because the abbreviation for lieutenant is LT. So L for latissimus dorsi, T for teres major. Okay. Now let's add in the subscapularis muscle. So we're looking at the same picture, except now we've got the subscapularis muscle on the subscapular fossa of the scapula. And again, subscapularis is the anterior rotator cuff muscle. And we've also added in the long head of triceps brachii. Triceps brachii has three heads. The long head is the one that articulates with the glenoid fossa, in particular the infraglenoid tubercle of the glenoid fossa, which is posterior to the subscapularis right here. We can't actually see it. But notice by adding in subscapularis and long head of triceps, we've actually created three spaces right here. This one is the quadrangular space. We've talked about these in previous videos. Here's the triangular space, and this is the triangular interval. Now the significance of these, remember, is that there are two structures mainly that pass through the quadrangular space posteriorly. And those are the axillary nerve and the posterior humeral circumflex artery. Now they pass posteriorly through this, meaning that they're actually going to go through this space into the screen. and they're going to emerge on the posterior side of the humerus. Here's the triangular space. One structure passes through here, posteriorly, and that's the circumflex scapular artery. Again, because it's passing through posteriorly, it's going to come through the screen and emerge posteriorly on the other side here. And then the triangular interval, nothing actually passes through here. However, we can get a good look at the radial nerve and then also the profunda brachii artery, and they're going to be on the posterior side of the humerus. Again, we'll talk about that in future videos in more detail. The other thing that we've added up here, I'm actually going to zoom in a little bit so we can see it better, is I've added in this ligament here that actually connects the superior margin of the scapula to the coracoid process. And this is actually called the superior transverse scapular ligament. Superior transverse scapular ligament. What it does is it goes across the top of the suprascapular notch, and it encloses the roof of it to create a suprascapular foramen. So this little hole that's created in the suprascapular notch is called the suprascapular foramen, and it's made by this superior transverse scapular ligament. And the importance of this is actually that the suprascapular nerve will actually pass through this foramen. The suprascapular artery goes on top, A above, A artery goes on top, and the nerve actually goes through this foramen. Okay, so just wanted to point that out. We're going to add in a couple other things. Now we add in the biceps brachii, coracobrachialis, and then also this transverse humeral ligament. So again, the biceps brachii, two-headed muscle. We can see the long head of biceps brachii coming here through the intertubercular sulcus or groove. And then we notice that there's this ligament that actually goes over that long head of biceps. And what it does is it connects the greater tubercle really to the lesser tubercle. That's the transverse humeral ligament. It holds the long head of the biceps brachii tendon in place as it curves around here to go insert on the supraglenoid tubercle of the glenoid fossa. Also, we have the short head of biceps. The short head is more medially placed, and you can see here that it originates on the coracoid process. In addition to that, the coracobrachialis also originates on the coracoid process, but the coracobrachialis is a much deeper muscle, and so we can't see its insertion, but it would insert about halfway down the humerus on the medial side. Also down here, here's the main tendon of biceps brachii. You can see it inserting on the radial tuberosity. But also notice that the biceps brachii has another tendon-like structure called the bicipital aponeurosis, which actually wraps around the ulna. And so technically, the biceps brachii does not just insert on the radius, as most textbooks will put, it also inserts on the ulna, giving the forearm more stability when the elbow is flexed, which is the action of biceps brachii. Now let's take a look at this picture. So in this picture, we can see most of the superficial muscles. So we're looking at superficial structures. In a couple of slides, and we'll probably start it in the next video, we're going to be peeling off a lot of these structures and we'll be able to go in deeper. But we need to get the superficial structures first. Let's start by looking at the musculature. So this muscle right here, this is the deltoid. That's always a good place to start. This is the pectoralis major. In particular, this head of the pectoralis major is the sternocostal head, because you can see it originating from the sternum, and then inferiorly it would actually be originating from some of the costal cartilages. This is the clavicular head of pectoralis major. It's been cut to expose the underlying fascia. Now this is important. If you were to peel off either of these heads, it could be the clavicular or sternocostal head, there would be fascia deep to the pectoralis major. This fascia is called clavipectoral fascia. Okay? Underneath that fascia would be the pectoralis minor. So if you were to stick a needle right here through the pectoralis major, you'd go through the pectoralis major, clavipectoral fascia, and then the pectoralis minor, assuming you were in the area where we have the pectoralis minor. Okay? Here's our trapezius muscle. We go to the neck. These two muscles are the two parts of the sternocleidomastoid. This one that's more medially placed is the sternal head, because it is originating on the sternum, and this over here is actually the clavicular head because it's originating on the clavicle. Now if we look lateral to the clavicular head of the sternocleidomastoid, we have this point right here where you can see that a bunch of nerves are kind of exiting superficially and serving the superficial structures around the axilla and the neck. This is called the nerve point of the neck, also called Erb's point. And you can see several nerves originating from this. So they're coming from the deeper structures and then emerging superficially. Going superiorly, we have the greater auricular nerve. Going medially over the surface of sternocleidomastoid is the transverse nerve of the neck. And then going more laterally, we have the supraclavicular nerve, which you can see is going to branch here and go over the pectoralis major muscles, and then go laterally over the deltoid. Right? A couple other vessels here. Right here we have the subclavian vein. We can't see too much of it. Now the subclavian vein is going to be coming from behind the sternocleidomastoid because it is a deep vein, and it's going to very quickly pass underneath the clavicle. It's going to pass under the clavicle and go over the margin of the first rib. When it goes over the margin of the first rib, it becomes the axillary vein. Now we can't see the axillary vein because it's a deep vein. It's deep to this clavipectoral fascia. That's important for this reason. Right here we have this superficial vein called the cephalic vein or cephalic vein. Now the cephalic vein, in terms of where it's placed on the arm, is the more lateral of the superficial veins. There's another superficial vein kind of in this region called the basilic vein, which we'll see later on. This is the laterally placed superficial cephalic vein. And notice that the cephalic vein is going medial to the deltoid, and it has to gain access to the deeper circulation because the cephalic vein has to return blood ultimately to the heart. Well, the cephalic vein is going to empty its blood into the axillary vein, but the axillary vein's deep in here, right? So it turns out that the cephalic vein is going to enter through this little space called the clavipectoral triangle. This is a small gap between the deltoid muscle and the clavicular head of pectoralis major. And when it moves through this gap, it's going to be able to pierce the clavipectoral fascia, and when it moves through that fascia, it'll then be deeper and it will empty into the axillary vein, which then takes its blood to the subclavian vein, and then that takes it to the brachiocephalic vein, and then ultimately back to the right atrium. Okay? So again, the reason that this has to go through the clavipectoral triangle is because it has to get to that clavipectoral fascia. And the reason it has to pierce that is because the axillary vein's deep to it. Okay? Remember that the clavipectoral fascia separates the pectoralis major from the pectoralis minor in deeper structures. A couple other things here before we move on. Here's the transverse cervical vein. It may look like it's going to the subclavian vein, but it's actually not. This actually drains to the external jugular vein. Okay? In fact, this structure right here is the external jugular vein, which will actually drain into the subclavian vein. These nerves right here, so this one and this one, these are the pectoral nerves, medial and lateral pectoral nerves. This one right here is most likely the lateral pectoral nerve, and this one is the medial pectoral nerve. They're backwards, okay, in terms of their placement relative to the pectoralis major, because you'd expect this one to be named lateral and this one medial. We'll explore this more in future videos, but it turns out that they're named medial and lateral based on where they branch off of the brachial plexus. So it turns out that the lateral pectoral nerve branches from the lateral cord, the medial pectoral nerve branches from the medial cord. Down here, we can see the biceps brachii muscle. There's some fascia overlying it, and that's the brachial fascia. The brachial fascia is really just the fascia of the arm. It's very similar to the fascia lata of the leg, okay? That is the thigh. And when it gets to the elbow, it'll become the cubital fascia, and when it gets to the forearm, the antebrachial fascia. And here's latissimus dorsi that we can see a little bit anteriorly. The last thing we're going to do in this video is look at a cross-section here of the axillary region, and then we're going to conclude the video, and then we'll pick up with more deeper structures in the next video. We're going to see some deeper structures here, but it's important first to look at a cross-section before we start looking at all this stuff. Okay? So let's get oriented with this cross-section. Okay? Here's the head of the humerus, and then that means this is the scapula right here. This is a really common cross-section to look at when you're doing the axillary region. This right here is the glenoid cavity or glenoid fossa of the scapula, and so this would constitute the shoulder or glenohumeral joint. Okay? All right, so a few things here. Here's also the intertubercular sulcus. You can see that groove right there, intertubercular groove. And then this would be the tendon, the long head of biceps brachii that runs through that groove. If we looked lateral to that on the lateral lip, this would actually be the insertion of pectoralis major. And then on the medial lip would be the insertion of latissimus dorsi and teres major. We're up a little bit higher, superiorly, so we're not going to be able to see those. They insert a little bit more inferiorly. This muscle over here is the deltoid. Over here would be the anterior part of the deltoid. This is the middle deltoid, and then this back here is the posterior deltoid. Now if we look at the scapula, we have a rotator cuff muscle directly on its anterior surface. This would be subscapularis. We know that this is subscapularis because it's on the anterior surface of the scapula. Okay? Back here on the posterior surface of the scapula, this is going to be infraspinatus. Okay? Most of the cross sections you see when you look at a posterior muscle on the scapula, you're going to assume it's infraspinatus, not teres minor. Okay? Teres minor is a lot smaller and it's much further down on the lateral border of the scapula. Okay? Over here, this muscle is actually serratus anterior. We know this is serratus anterior because we got the ribs over here. We can see those. And if we follow serratus anterior around, we can see that its posterior aspect, we can see it inserting on the medial border of the scapula. This is the cross section right here of the medial border of the scapula. Remember, that's the insertion of serratus anterior. Also, the rhomboids also insert on the medial border of the scapula. So this right here is rhomboid major. If we look anteriorly, here's the pectoralis major muscle, and deep to that is the pectoralis minor. Now if you remember from this previous slide, I mentioned that if we go deep to the pectoralis major, there's a layer of fascia called the clavipectoral fascia that separates the pectoralis major from the pectoralis minor. Now if we look at this space right here in blue between the pectoralis major muscle and the deltoid, this is the clavipectoral triangle, also called the deltopectoral triangle. And this vein that's right there, this is the cephalic vein. Okay? And recall that the cephalic vein is going to have to dump into this vein right here, which is the axillary vein. But in order to do that, it has to enter through this deltopectoral triangle or clavipectoral triangle. It's going to have to pierce this clavipectoral fascia, and then not at this level where the cross section was taken, but actually a little bit higher up, it would actually dump into the axillary vein right here. Okay? A few other things. This muscle right here, this is coracobrachialis. If we were to look lateral to that, somewhere here, we might actually be able to see the tendon of the short head of the biceps brachii. Okay? Recall that the short head of the biceps and coracobrachialis both originate on the coracoid process. Over in this area right here, in the middle of the axilla, again, remember the boundaries. We've got serratus anterior medially. Posteriorly, we have the subscapularis. Anteriorly, we have pec major and deltoid. And then medially, we've got the humerus and then coracobrachialis and long head of biceps brachii. Right in this space right here, we've got all this stuff, all these vessels and nerves. This artery right here is the axillary artery. And these three nerve-looking structures are the three cords of the brachial plexus. Okay? Remember that the cords are pretty distal in relation to the ventral rami from which they originate. So remember, the brachial plexus consists of ventral rami from C5 all the way through C8 and then T1. And they fuse into trunks, and then they give contributions to form cords. There's a lateral cord, a posterior cord, and the medial cord. And the cords are named in relation to their position relative to the axillary artery. So the lateral cord is lateral to the axillary artery, posterior cord is posterior to it, and medial cord is medial to the axillary artery. So right here, here's the axillary artery. The one that's most posterior would be this one. This would be the posterior cord. The one most medial to it would be this one, the medial cord. and the one most lateral would be this one, the lateral cord. Eventually, as you go further down, if the cross-section was taken further inferiorly, the medial cord would be a little bit more anterior placed, and so would the lateral cord. And so they would kind of move, still lateral and medial to the axillary artery, but a little bit anterior to it. Okay? And the posterior cord would remain posterior to it. One other thing I wanted to mention here is we have some of the suprascapular structures right here. This would be the suprascapular artery, suprascapular vein. Okay? Remember, the suprascapular artery is going to serve supraspinatus, and then it's going to move down and supply the infraspinatus, or at least part of it. And here's the suprascapular nerve, which basically does the same thing. Okay? We've talked about those in previous videos. Remember, the suprascapular nerve also is what crosses through this suprascapular foramen, and then it would go down posteriorly and serve the infraspinatus on the other side. The suprascapular artery goes over the top of this superior transverse scapular ligament, also going down posteriorly to serve the infraspinatus after they've both supplied the supraspinatus muscle. So hopefully this video gave you a good understanding of the axilla. We're going to continue talking about the axilla in the next video. So now that we've talked about the deeper structures with this cross section, we'll take some other views and look at other deep structures. Please make sure to like this video and subscribe to my channel for future videos and notifications. Thank you very much.